Hello, it's been a while. What has it been, like 2 months since I posted my last video, which I think it was about my adult autism diagnosis that I recently got. Um, as you may or may not know, I am in graduate school for speech and language pathology, so it's definitely been keeping me busy. um, I made it through another semester. Hooray. The last day was like, I don't know, some like first or second week of December, and I've been on winter break ever since, although it hasn't been very productive. This always happens to me. I don't know if it's the autism, the ADHD, the depression, the anxiety, all the things, but whenever I go on a long break, I tend to get depressed and I tend to not be productive and just it, I don't know, maybe it's like breaking the fact that I'm breaking out of that routine of always being like on the go and going and going and going and having so much to do and stressing about, work and school I feel like I'm running on adrenaline the entire time when I'm either at work or school. And then when I get a break, it's like I can finally breathe a sigh of relief, breathe a sigh of relief, release a sigh. How what even is that saying? I don't even know what I'm trying to say, but I think you get the point, right? But yes, breathe a sigh of relief. There we go. And then I can slow down, but I think I overdo it. So like my sleep schedule gets messed up, so I'll stay up all night, like either watching anime or lately I've been reading Jujutsu Kaisen fan fiction online because I don't know, I'm weird like that, I guess. I've been waiting for the new season to start, and I'm excited because it'll the new episodes will be coming out in just a couple days. So anyway, point is that my sleep schedule's now messed up. I'm going to sleep super late, like 2 or 3 in the morning, and then waking up late, and I think that messes with my circadian rhythm, which in turn messes with my mood, um, which I don't think does anything good for my depression and my anxiety and all these other things that I have going on. But this last semester was definitely a doozy. I was really struggling. We were taking 3 really intense classes. On top of that, we were doing our clinical placements 4 days a week on top of all of the like exams and the coursework. We had to go into an actual school placement. For me, my placement this time was at a high school. And if you've been kind of following my mental health journey, you know that I also have like social anxiety and I struggle with like with transitions. So getting to know new people and getting accustomed to like a new workplace. And that's what it was from August to like the first week of December. Getting used to like my supervisor, the way she handled things, the things that were expected of me. She was expected me to see like larger groups, like groups of four kids where I was previously working. I was really only used to seeing groups of 2 to 3 kids max. So that was a change. Working with a mod severe high school population was also a change because at the previous my place of employment was mild to mod, so the population is a little bit different. So it was a lot to kind of take in and try to manage. And thankfully, I think I managed it okay, as well as I could have. She gave me. I passed that specific clinical placement with flying colors. I can't talk today. Also, I made a new friend. Another person who's also working on her master's in speech and language pathology, who also had to do her clinical placement. She was placed at the same high school that I was at, but she is at a doing her master's program for a different university, but we just happened to land at the same placement, and we actually became really good friends, because we were dealing with all the same struggles and um, trying to get used to to working with the kids, and keeping up with our supervisors' expectations. It was rough. I'm not gonna lie. It was not an easy placement. But we made it through. But it was a lot. Like there were times where I felt like I wasn't keeping up with my coursework and the full-time clinical placement, and I wasn't sure if I was going to pass one of my classes. It was the dysphagia course, the swallowing class. I think I've mentioned that speech therapists also work with swallowing disorders. Like our scope of practice, the things that we're expected to know is huge. It's very broad. Kids who struggle with speech sounds, who struggle with language and understanding, adults who have swallowing disorders, kids who have swallowing disorders, adults who have had strokes or traumatic brain injury or dementia, like whatever affects communication and swallowing, that's what we do. But for me in particular, I just want to work with the kids. It's what I've been doing for the past almost, let me see, I started in 2022, in December of 2022. So it's what I've been doing for the past 3 years now. It's what I like to do. I feel comfortable working with kids more so than even working around adults or being with my coworkers. But unfortunately, our scope of practice as SLPs or speech pathologists is very broad, and so we're expected to do all these extra things. So, dysphagia, which is just a fancy word for swallowing disorders, that's one of those things that we're expected to know how to diagnose and treat. And so, that class I had this last semester, and it was particularly difficult for me, but thankfully I did pass it. And I am now going into my very last semester of graduate school, which will be starting in another like week and a half on the 20th. And and I have to do another full-time clinical placement, actually at two different schools this time. So that's two new supervisors and two new schools that I'm gonna have to get used to and get acquainted with. And meet two different supervisors' expectations and be at two schools, like a couple days at one school and a couple days at the other school. And it's very stressful for me um, to get used you know, to doing that. So it's going to be a little stressful, but thankfully, I don't really have any courses that I'm going to be taking except what we call our comps. So that's like our comprehensive exams, which are basically case studies where we will be expected to meet with a patient or student via Zoom, and maybe, I don't know if we're going to have to assess them or just provide treatment. But our supervisors and our clinical coordinators will decide that. It's like the big exam that's supposed to wrap up everything that we've learned over the course of the entire master's degree program, and that's how we're gonna be tested on it, the actual application of assessment and treatment. And I think it's gonna be like one adult patient, maybe one child patient. And so it's kind of a big deal. If you don't pass the comps, you don't get your master's degree. So it's stressful, but at least it's not really classes. It's just preparing for the comps, going through the comps, and hopefully passing it. And then I have to take the praxis, the SLP praxis, which is just another exam, which it's all multiple choice, and it's also kind of like a cumulative exam to test our knowledge. So those are the two big things that I'm going to be doing this semester, plus the two clinical placements at the two different school sites, and that'll be my last semester. Starts January 20th, ends like May 15th or something. So it's just 4 months, which doesn't sound like a lot, right? I'm almost there, but I'm in the home stretch, but it's kind of it's not going to be an easy home stretch, to say the least. It's going to be stressful. But yeah, that's why I haven't come on here. So I've just been busy, and um, yeah, that's like an update on my university life and where I'm at right now with my master's program. I am still working part-time at the previous schools that I was working at. I was working full-time as a speech therapist on a waiver. That might sound confusing because I'm working on my master's degree, trying to get my degree to become a speech therapist. So you might think like, how are you already working as a speech therapist? There's a couple states, I know California and possibly Nevada might be another one, where there's a huge shortage of speech therapists. And so they allow us to work on what they call a waiver or emergency credential, so long as we can prove that we are enrolled and actively attending and working on our master's degree, which I am. And like every semester, I had to they had to look at my grades and make sure that I was making satisfactory progress toward getting my degree so I could continue to work on the emergency credential as an actual speech therapist. So I don't have my degree yet. I don't have my credentials. I have an emergency credential that I was using to work full time as a speech therapist um, for a school, for two schools actually. They're connected. And so I'm still working part time at one of those schools, but I've really had to cut it down because this last year of graduate school is very intense. It's like full time clinical placements. They would not let me do my clinical placements at my current place of employment because they said that my supervisor could be biased when they were grading me and giving me feedback because they already knew me. So my university specifically had to pick where I was going to do my clinical placement. It was at a different school, a high school, and of course, none of our clinical placements, even though we're pretty much working full time, they're not paid. So I took a huge cut to my income, and I had to take out student loans. And it sucks, but that's just like the reality of the situation. Um, and so yeah, I've only been working like I think I only had Fridays off, so I've only been working like 2 to 3 Fridays a month, like 1 to 2 actually Fridays a month whenever they called me in. Um, and then I have to go back to my regular place of employment next week, uh, like on the 15th. And that'll be my last day working there until I finish this last semester of graduate school, which is in May. And after that, I plan to actually, once I get my degree, I plan to continue my employment there. So get hired on full time if all goes well. Get hired back on full time because it's easier that way. Like I don't have to get used to a whole new setting again and new supervisors. I am so tired of all of that. I want to be done with this degree and to start making money like an adult again because it's honestly been so stressful living on student loans, which is barely enough. I'm lucky that I'm with my parents. Otherwise, I would not be able to afford a house or an apartment or even a studio here in California with my son, and groceries and everything else that comes with being an adult and adulting and trying to get through a master's program. Um, yeah, so that is a an update on that. I'm gonna make another video because this one's getting long, but I've actually been thinking about possibly moving to Europe, and I know that sounds totally insane, but that is a topic for my next video, which I'm actually gonna record right after this one because I never seem to find the time to make these videos, so I might as well just do it now. Let's see.